begin, we will talk a little bit about the background, starting from the fact that physiotherapy aims to develop, maintaining, and restore to the maximum the movement and functional capacity throughout the life of a person, and that science the studies of fetal movements became possible due to observations and defined that as general movements that can change their quality, be abnormal or absent, determining the consequence that will generate factors such as alcohol intake in mothers led physiotherapy to intervene, seeking its object of study from an early age.
So, in the introduction, our research proposal is cross-sectional study that seeks to find out if there is any correlation between the mother's alcohol consumption during pregnancy and the quality of the newborn's general movements. The design that we are going to use is a described study. So, probably at the end of this study, we will be able to correlate alcohol consumption with the quality of the general movements of the babies. So finally, one of the possible limitations that we can present is not having a big population to be able to analyze.
Having this in mind, their problem statement was posed with the following question: what is the relationship between maternal alcohol consumption during the pregnancy and the quality of the general movements of newborn?
So first, pregnancy it's a moment in the life of the woman where a baby grown in her body. So the alcohol is one of the substances of their consumption at social level and have a huge impact on public health. For this reason, the consumption of alcohol during the pregnancy can deteriorate the nervous system and affect the motor action due to the long effects that last in the body of the baby at the womb. Therefore, this study aims the early recognition of the physical disturbances that occur during pregnancy to intervene as early as possible to reduce the possible damages and have a better behave of the motor development.
Continue, a general objective was set, which is identify the relationship between alcohol consumption by pregnant mothers and the quality of general movements in newborns. And this will be possible through two specific objectives. The first one is describe normality in the presentation of general movements in newborns, and the second is determine how alcohol intake during pregnancy is a precursor of complication at the nervous level that are reflected in a motor way in the quality of the general movements of newborns.
We use articles in English and Spanish between 2015 and 2023. These articles were found in databases like PubMed, Cielo, and Eureka. The terms that we use for these are placed in the presentation, and the principal findings that we have are that alcohol have a prolonged effect on the amniotic storage, reducing the concentration of metabolic enzymes to the growth of the baby, damaging the growth and the fetus in the posterior way. The general movements help to identify risk of neurodevelopmental levels of damage. Also, the first trimester is the most sensitive moment for consuming dangerous substances or components that can affect the baby. Heavy amounts of alcohol is related to nervousness, tremor, hypotonia, decreased habituational to stimuli, decreased bodily vigor in newborns, and have an immediate effect on the brain function and increase the risk of neural tube deafness. Also, the alcohol can affect the height of the baby in the gestational age and alter the motor behavior and general movements in the ages between 3 to 4 months.
Regarding the methodological framework of this research, it is essential to highlight that it is a type of quantitative research. Its type of design is observational, described, and sectional study, since the design allows us to describe the quality of general movements in the observational way. Children whose mothers consumed alcohol during pregnancy and the population are newborns with a sample of newborns from 0 to 4 months whose mothers have consumed alcohol during at the last 3 months of pregnancy continually or discontinually. Likewise, they identified that the independent variable is alcohol consumption and the dependent variable is the alteration in the quality of movement. On the other hand, the type of sample non-parametric and the convenience. And we have a warranty of methodological rigor. On the one hand, we have internal validity that is a physiotherapist training in the analysis of general movement in newborns and the external validity, the person who performs the observation, and a description must be a health professional with knowledge of general movements, must as the same instruments for bad data collation and materials for capturing observation. It is also possible to identify research instruments and techniques where the alcohol consumption variable will be measured by asking the mother of the newborn how many bottles of liquor will she drinking during the pregnancy. And the described hypothesis science is attempt to predict a change in general movements during the alcohol consumption during pregnancy. Maternal alcohol consumption during the pregnancy has negative effects on the general movements in the newborn. To conclude this part, we refer to ethical considerations such as the Declaration of Helsinki and the ethical guidelines for research related the health in humans, which are standards that provide us with international accepted ethical principles on how to apply to universal ethical principles that must be considered with investigating the effects of alcohol during pregnancy on the general movement of the neonates, ensuring that the risks are minimized that reasonable in relation to the importance of the investigation. Finally, we fear environmental consideration, such as the transmission to the subject of relevant information about the study and the understanding of this information by the subject whose 6 paper sheets will not be used. The information will be collected electronically. On the screen, we can see the informate concept and as a description of intervention and process. The first part, sync informate concept, informing the objective of the research. The second part, application of the evaluation instruments 1, 2, and 3. Third, informing the participants of the results of the investigation. And finally, statistical analysis will be carried out. Thank you.